We have heard a great deal about the Ebola virus in the news, and in this video we'll explain what Ebola is and how you can protect yourself from the virus. Ebola virus is a very serious condition that's usually fatal. Currently, there is no licensed treatment or vaccine. This disease is a huge threat in Africa, but for people living outside these countries, it remains a very low threat. Ebola was first identified in Africa in the mid-1970s. An outbreak that began in March 2014 was by far the most serious. By October 2014, it killed more than 4,000 people across Guinea, Liberia, Sierra Leone and Nigeria. We could see cases of Ebola within the UK. This happens where individuals live or work in the affected areas and travel back to the UK. When they arrive in the UK, they bring the virus with them. An example of this was in August 2014. A British nurse who was treating patients in Sierra Leone contracted the Ebola virus and was flown back to the UK for treatment in a London hospital. Even though this has happened, experts studying the virus believe it's very unlikely that the disease will spread within the UK. Ebola is spread by contact with blood, body fluids or organs of an infected person. The good news is that following infection control methods, we are able to minimise the risk of infection. It's likely that people who will contract the virus are those who are giving care to people who are infected, either by directly touching the victim's body or cleaning up the body fluids, stools, urine or vomit, that carry the infectious blood. Ebola can survive for several days outside the body, often on the skin or the mouth of an infected person. In Africa, when a person dies, it's common for the mourners to touch the body of the deceased. Where that person has had Ebola, it's passed on to the individual who touched the deceased person. This has helped the virus to spread. There are a few other ways that Ebola can spread. These include touching the soiled clothing of an infected person, then touching your mouth, having sex with an infected person without using a condom. The virus is present in semen for up to 7 weeks after the infected person has recovered. And handling unsterilised needles or medical equipment that were used in the care of the infected person. A person is infectious as long as their blood, urine, stools or secretions contain the virus. The Ebola virus is generally not spread through routine social contact, such as shaking hands with a patient who has got the symptoms. The virus is not, for example, as infectious as diseases like flu, as airborne transmission is much less likely. You'd need to have close contact with the source of the infection to be at risk. So who is at risk? Anyone who cares for an infected person or handles their blood or fluid samples is at risk of becoming infected. Hospital workers, laboratory workers and family members are at the greatest risk. Strict infection control procedures should always be followed. Wearing protective clothing minimises the risk, and simply washing hands with soap and water can destroy the virus. An infected person's symptoms will typically be to develop a fever, headache, joint and muscle pains, sore throat, and intense muscle weakness. These symptoms start suddenly between 2 and 21 days after becoming infected, but usually 5 to 7 days. Diarrhea, vomiting, a rash, stomach pain, and impaired kidney and liver function follow. The patient then bleeds internally and may also bleed from the eyes, ears, nose or mouth. Ebola virus is fatal in around about 50 to 90% of cases. The sooner the person is given care, the better the chance that they will survive. There is currently no licensed treatment or vaccine for Ebola virus, although potential new vaccines and drug therapies are being developed and tested. Patients need to be placed in isolation in an intensive care. Dehydration is common, so fluids may need to be given directly into a vein, intravenously. Blood oxygen levels and blood pressure need to be maintained at the right level, and body organs supported while the patient's body fights the disease, and any other infections are treated. There are many experimental drugs under development. ZMapp is one of these, and it can be tried, although it has not been tested in humans for safety or effectiveness. The product is a combination of 3 different antibodies that bind to the protein of the Ebola virus. Where anyone has been diagnosed with Ebola, the area must be immediately quarantined and the patient treated in isolation. Healthcare workers need to avoid contact with the bodily fluids of their infected patients by wearing face masks, goggles, gowns and gloves. Take extra care when handling blood, secretions and catheters and when connecting the patients to a drip. Disinfect non-disposable medical equipment before it's reused. Ensure that you sterilise and dispose of used needles and disposable equipment carefully, and properly dispose of any secretions or body waste from the patient. Always carefully and frequently wash your hands with soap and water. Use alcohol hand rub if soap isn't available. So one thing that worries people is, what if they have been on a flight with someone with Ebola? Are they at risk? You cannot catch Ebola through social contact or by travelling on a plane with someone who is infected without direct contact with the blood or body fluids of an infected person. Cabin crew identifying a sick passenger with suspicion of an infectious disease on board, as well as ground staff receiving the passenger at the destination, would follow their internal process and International Air Transportation Association guidance for suspected communicable diseases. If there is someone unwell on board a flight, the pilot of the aircraft is legally required to inform air traffic control. Arrangements will be made for medical assessments for the person on arrival. The exact arrangements will depend on the airport involved. The local public health team would be alerted if there are any possibility that the individual was suffering from an infectious disease, so appropriate public health action could be initiated. If you're working with patients that could have Ebola, you must ensure that you fully follow the latest guidance in protective personal equipment and its correct disposal. Exact guidance is changing at the moment, so we cannot give you any exact advice in this video. Finally, since planning this video, news on Ebola is changing, and the World Health Organization are suggesting that the death rate will double every 4 weeks, and other suggestions are that if serious action is not taken, then there could be hundreds of thousands of cases within 6 months.